Hi viewers, I really wanted to talk about this topic very briefly. And the question is, should you still get colonoscopy if you're over 75? I just had to scope a patient, and I'll tell you about that in a second. But if you do like this material, then please do feel free to, like, subscribe, share, make some comments if you wish to. And again, back to the story. Scoped a patient today, 84-year-old guy with anemia. Never had a colonoscopy in his life, and did the scope. I had a mass, very suspicious for cancer in his right colon. Of course, he was upset by that, and I was upset too for him. And I wish he'd had a colonoscopy. Maybe this would have been determined 10 years ago or several years ago. Maybe this could have been prevented. But the question is, if you're over 75 and so you've had your colonoscopies, should you stop? And the guidelines sort of say yes, after 75 you don't need it anymore, and some guidelines sort of individualize it. I personally, in my practice, individualize. So if somebody's really healthy, they're in great health, like this guy was actually really good health, then I would encourage them to really strongly consider doing it, because 20% of cancers, colon cancer doesn't respect age, but about 20% of colon cancers actually happen those over 75. So it doesn't really make sense to have this sort of 75 and you're done type of thing. Plus, with modern medicine, people are living longer. People are maybe a little more health conscious as well. So I sort of individualize it, and I basically say to the patient, listen, if you're really good health in 5 years, 10 years, whatever it may be, and you're not having any cardiac problems, heart problems, then you can definitely consider it. So I mean, if you have had colonoscopies before, then you can consider doing them. And if you've never had a colonoscopy, and suddenly you feel like you're 18 and, hey, you don't want colonoscopy, then you should also do it, because there's a lot of evidence that even in this age group, you can find pathology, you can find the beginning, like I just mentioned, 20% of cancer are in this age group. So it can make a difference. So basically, the main limiting factor is going to be your overall health. Can you walk? Can you do your activity daily living? Do you have significant cardiac problems? Do you have significant pulmonary? These are the factors that are going to make me decide whether or not you should be a good candidate for colonoscopy. Anyway, I just wanted to share that with you today, because it was a bit of an upsetting time for the patient, for me, and also it's one of those topics that comes back a lot, and unfortunately I've also seen it before in other patients similar ages. So yeah, please, if you have any questions, feel free, and as always, keep healthy. Thanks.